Avicenna Medical Practice, Jenna speaking.
We work in a general practice. We were aware that patient experience was quite low. Staff had commented on that patients were having to wait outside in cold. Patients couldn't get through on the telephone or get appointments. We wanted to make sure patients could be seen on the day when they rang. They didn't have to wait. So we implemented a new system of access for patients to see the right person at the right time.
The new system where we now have patients ringing on the morning between the hours of 8 and 12 o'clock, and they will be seen by somebody in our triage team, whether it's a nurse, GP, practice nurse. We also have the facility on the morning now of coming down between the hours of 8 and 9, and they will be triaged face to face by one of our clinicians. They'll either deal with them there and then, or if it's something a bit more trivial, they'll call them down later on that day.
We are measured national surveys, local surveys and friends and family tests. In August last year, friends and family, we were only getting in the 40s and 50% ranges of patients who'd recommend our surgery. We're now in the 92% range of patients who'd recommend us. Everybody's worked together to make sure it's been a success. We've asked for regular feedback from the patients and from staff, having meetings, looking at how it can continue to be developed and improved. So it's been a whole practice effort.
Social prescribing, what happens is GPs, nurses or pharmacists are able to send a prescription into our service asking for us to go out and see patients who've got one or more long-term health condition. What it is, it's looking at alternatives for healthcare and social care other than the traditional social care and NHS services. 68% of the patients that have been referred has lowered their contact with their GP. A lot of people have actually reported that they've experienced a lessening in anxiety and depression.
These guys, they've helped build my confidence. When I lost my husband, I lost all my confidence. They are really friendly, they put you at ease, and it's made life feel like it's worth living.
Teamwork is crucial. We don't just see teamwork as just our small team. That's extended out to the partners that we work with so that we can benefit the people that we support. People often say think outside the box. We don't have a box. So we're allowed to be creative. So when you're looking at the person that you're supporting and they've got a smile and self-belief and feel value and starting to develop the confidence, and you see those small steps, it's just fantastic.
It's been our job for the last year to save the Trust £20 million. We've had to work with other people in the organisation to find lots of creative and tried and tested ways to save money. Really quickly, in a matter of about 2 weeks, we had to be up and running and ready to begin to put all the plans in place. And that meant for a lot of people giving up the jobs that they were already doing and taking a risk to come and work in this team. If you'd have told us this time last year when we started setting up that we'd have had the success we have, we would have all not really believed it because we knew it was going to be hard. But we've managed to put in place a savings programme that's overachieved every month in the first 6 months of the year.
There's a lot of projects. Some are looking at things that have been in the pipeline for a long time but maybe haven't had enough momentum to actually get them going. And then some are new schemes. So in outpatients that I'm involved in, we've looked at something called tagging of records so that people spend an awful lot of time at the minute, wasted time, running around looking for things that actually the tagging system will tell them exactly where it is. So it's things like getting rid of waste. I think the turnaround team have been successful because we've all worked in NHS quite a long time, so there's a lot of experience. We all really care about the NHS and about the Trust. And then we've had really good comms support. We've been out in the business, we've been talking to people, we've took their ideas on board, we've involved everybody, so the whole Trust's felt part of it.